Welcome to Healthcare Matters, the podcast where we explore key topics shaping the future of healthcare. Today, we are diving into a crucial aspect of our industry, healthcare compliance. But we are not just talking about regulations. We are actually discussing how healthcare compliance can be an enabler for innovation and protecting our patients. We are so glad to host today Dr. Hannes Oswald-Brügel, the Global Head of the Roche Pharma Compliance Office, a leader with deep expertise in healthcare compliance. He will share his insights on how a strong compliance culture can really be an enabler for healthcare and, as mentioned, driver for innovation and our patient safety. Warm welcome, Hannes. It's a great pleasure to have you, and thank you for being with us today.
Thank you so much, Heather. Really an honor and pleasure and almost embarrassing. Thank you so much.
It's amazing to have you, and maybe let's start by asking you if you please share about your journey with compliance and how have you seen the role of compliance evolving in the healthcare industry?
I love that question because there's a lot to it, and it shows me I'm growing older because I've been around quite from the early days on, and we always said, oh, it's still a young profession, but I reflected, no, it's not that young anymore. It's some 20 plus years now. Initially, many of us came from the legal department, as I did, and it was a bit like we have that new thing and it needs to go somewhere, and you're taking care of all this interesting stuff. Couldn't you also take that part on? To be very frank, many of us didn't really know what that exactly was, how that was different from legal. And I personally only accepted it because, I got more insights. I was able to set up a team and, so I could broaden my expertise and stuff. But I wasn't a big fan of it because as many of us, and some even still today, I thought like, oh, this is the sales prevention department. And, while I was a friend of the business, enabled the business all the time, now they make me block the business, which I wasn't really happy with. But then over time, we all discovered and observed it depends on what you're bringing to the table. And you can be a perfect business enabler if you help your colleagues and if you show them ways how to do stuff. I always said no is not an answer. If somebody spots a problem, asks you, and you just confirm the problem and say no, you're adding zero value. So it's really like helping the business to grow and help, doing things in an appropriate, in an ethical way, for the good of the patient. And I see that, and this is a bit the journey, in a nutshell. There's a lot more to say to it, how the compliance profession evolved in the recent years.
Great reflection, Hannes, and that will take me to my second question, because some people would say or would see healthcare compliance, as a barrier to innovation, while I believe it is the opposite. So from your perspective, how healthcare compliance can be an enabler for healthcare innovation?
Yeah, you just said it, I already touched upon it. No is not an answer. And there is, it's oftentimes that the facts, or not oftentimes, probably always, the facts are faster than the laws and the regulation. Something new comes up, AI comes up, somebody thinks, oh, we need to regulate that, probably, now that it's there. And this is exactly where compliance can add the biggest value. We called it navigate the gray. There's something new. We want to keep an ethical behavior. We want to move ahead. We want to be innovative, and we want to do it in a sustainable way. And navigating that part, concrete example, COVID came up, and the question was, now that we are moving global congresses into a virtual setup, what regulation do we apply? The initial idea was of the International Pharmaceutical Association was, initially the Congress was to be held in Amsterdam, so we'll apply the Dutch code. And then, we said, hey, wouldn't it make sense to have like a global code and just apply the IFPMA code? That was completely unclear, and solving those questions, I think that's where we can add the most value.
Ah, great. And you mentioned that facts can be faster than laws and regulations.
Yeah.
We live in Europe, and we know that Europe is very dynamic in terms of regulations, initiatives, and new laws. From your perspective, what new law that can really impact our patients, either well-being, safety, and care in the coming 1 or 2 years you think about, and if there is something you are personally excited about?
Excitement is a funny question in that point because regulation always comes with restriction, and I think it's crucial to find the right balance between restricting but still keeping things possible, enabling. One of the recent examples that we have seen is the data protection.
Okay.
Where there was a lot that has been regulated, and also a lot of smart ideas that were coming with a very good intention were hardly possible, or very had quite a lot of barriers in their realization because of that high degree of regulation. So regulation is always, it has pros and cons. You can't go unregulated because we need to take care of a few things for patients, for us, for society, and still we need to keep the door open. What's on the horizon, I see a bit of a tendency to rethink 1 or 2 things because, for example, in a few European countries, people observed, hey, we're leaking behind in the digitalization because we have so many regulations in the terms of data privacy. I think that's something that is being looked at. I've also seen post-COVID, people saw Roche, or people saw pharma as an industry, not just as a cost center, but really as someone who brings value. We have helped the world to get back to normal as an industry. So I'm hoping for a bit of that tendency. But I couldn't name anything. That's the new thing that will help us. I think generally it's always finding the right balance. And currently I'm seeing there is a good momentum post-COVID, and also with a few realizations to enable more in the term of in the direction of digital and artificial intelligence.
Data is very important indeed, and it can really help us to view healthcare as an investment rather than a cost center, as you said.
Yeah.
And that will take me to the next question, because also you inspired me to think about the future. So we know that technology is rapidly changing the healthcare landscape. So from your perspective as a healthcare compliance leader and expert, would technology and compliance become a best friends? Is that, possible from your perspective? Or it's kind of difficult to align both?
No, I think actually they're super close and really good friends. In my ideal world, we wouldn't need to give a lot of input. We could focus on some really crucial landmark topics, but the day-to-day should be almost go unnoticed. We call that compliance by design. For example, if you're engaging external partners, all of that should automatically happen in the most ethical and compliant way because there is a background work. Today we do that with algorithms, we do that with standard process, and I think that's where artificial intelligence can add so much more. Only last week we've been experimenting with it again. We had partners from the compliance departments around the globe with us, and feed it our Roche chat, and tried, can it help us improve the guidance? Can it help us regulate stuff? Really interesting. I think it's still early days. The prompting these days is a bit like the key thing. If you put the right prompt in, you get a great answer, and that can just alter by a single word. So I guess there is still room that needs to grow, but for the future I foresee a lot of positives in there. Yes.
Great. It's great and inspiring to see really technology and healthcare compliance as best friends. And as you said, the sky's the limit. Maybe we'll see more and more benefits using artificial intelligence and other things.
Yeah, it feels a bit like, you know, the interface or the user is still a bit the problem, and you know, we need to get better there, and you know, the AI needs to get to better understand us, but I think we're getting there. If I may, speaking of the future, I would have a question too.
Yes, please.
Where do you see us compliance headed to? And you know, in terms of mindset, obviously, but also in terms of I think it was a Canadian ice hockey player who said, you know, skating to where the puck will be. Where do you see the puck headed to, and you know, how can we best go there from our perspective?
I think we're evolving, as you mentioned in your first reflection. So over the past 2 decades, for example, we have seen a lot of great evolution of healthcare compliance, and I believe mindset is key. So personally, when I reflect on that, I think the 2 key words are proactive and forward thinking. And what do I mean by that? When we approach any project, for example, as leaders, and encouraging our teams as well, do we really embrace compliance as a priority or no? When we really craft one project, and we ask the very simple question: if this initiative or project tomorrow is on the newspaper or on the TV, do you feel really proud of what you are doing for the healthcare system, for the patients? Or you would be shy and you don't want to relate yourself with this one? So really keep compliance as priority. The second reflection, that we really encourage our team to get engaged with the legal teams, with the healthcare compliance team early on. From the very first phase, when you identify a challenge and you want to create a project or initiative. So we always encourage our teams not to wait for the last minute and then consult or try to fix the final product, to really be proactive. And the last reflection, that encouraging always our teams to live this learning organization and learn on the go as we do things for our patients and for our healthcare system. So I remember in the recent example, in the past couple of years, I was like a business sponsor for one multi-site audit, and it included 7 European countries. And after the audit, we encouraged the 7 countries to really share their learnings and their, you know, challenges. Because you remember in the old days, when you have an audit, you have this stigma and you want to keep it private and confidential. And I think now there is a mindset shift, where in this story I'm sharing with you, we had 7 countries sharing these challenges, sharing what they have seen in the past and what they have learned. And that really helped us to build a better strategy for the future, to address some of our risks. So again, back to your question, I think the future is really going in the right direction. And again, but it needs a lot of proactive and forward-thinking mindset. Maybe as we are coming to the close of our discussion and episode today, I wanted to ask you, because you have seen a lot in healthcare compliance in the past 2 decades, if you have a specific example where you have seen healthcare compliance really enabled innovation and was really a driver for healthcare innovation. Do you have any example on top of your mind?
I mean, the key example that comes to mind is our, we call it internally the Roche Symphony guidance, which is, you know, the orchestration of medical and commercial, and, you know, the global agreed standard of keeping those separate. And as you're very well aware, we have I think a very modern and a unique go-to-market model, how we engage with our customers. We received feedback over the years. You're a nice company to work with, but you have a lot of people out there, and they are all coming with separate needs and or with separate topics. And it would be great if you couldn't have like something like a primary point of contact. And we help from a healthcare compliance perspective to enable that model. It wasn't easy, to be frank. You know, it brought me a few sleepless nights because, as I said, it is a very unique, but I think it's a very honest and therefore very ethical model, because we have overcome a few hurdles that we thought were unthinkable to change. And now we're very confident that we do everything in the most ethical way, but also in the most modern way. So that would be my pristine example, because I've personally worked a lot on it, but also the wider team and the wider organization. The entire compliance team has been involved. Externals have been involved. We also wanted to make sure that we're not sitting there in our Roche cosmos and come up with something, and then in the end some external says that's an absolute no-go. Even the externals applauded us and said that's a really good model, and it's also very compliant.
It definitely has driven really a lot of clarity and positive impact, either externally on our customers, partners and collaborators, and definitely internally as well. Thank you for sharing this example. Any final reflection or thought from your side, Hannes, as we are coming to a close?
I want to go back to what you said, be early in, be anticipative. And that is also exactly a bit the tagline from the Pharma Compliance Office. You might be aware, it's like simplify, collaborate, anticipate. I love this forward directed, so that you can adjust on the go because you have a clear target. And you have a clear understanding, also being really close. That's the other part, being closely and early involved so that you're understanding the background, all the aspects in it, and then help things to develop in that future-directed way.
Thank you so much, Hannes, for the insightful discussion. It was a real pleasure having you today in Healthcare Matters. And indeed, healthcare compliance is really a crucial part of our industry. It really drives positive outcomes for our patients. If we have the right mindset, it will help us drive innovation and protect our patients. And I would really quote Hannes, so please simplify, anticipate, and collaborate, because healthcare matters.